The Bradford Hill Criteria are a set of 9 principles introduced by Sir Austin Bradford Hill in 1965. These principles help determine whether a relationship between an exposure, such as smoking, and an outcome like lung cancer is truly causal. They are especially valuable in public health and epidemiology, where conducting experiments may not always be feasible or ethical. By using these criteria, we can evaluate whether a particular exposure is causing a health problem. Let's now explore the 9 criteria to better appreciate how Bradford Hill's work helps in assessing causality. The first criterion to consider is the strength of the relationship. The stronger the connection between the exposure and the outcome, the more likely the relationship is causal. For example, smokers have a much higher risk of developing lung cancer compared to non-smokers, and this strong link suggests that smoking is a significant cause of lung cancer. Next, we look at consistency. If the same relationship is observed in different studies, settings, and populations, it strengthens the evidence for causation. Numerous studies from various countries show that smoking is consistently linked to lung cancer, which further reinforces the strength of this connection. From there, we consider specificity. If a single exposure leads to a specific outcome, it supports the case for causality. Smoking, for example, is directly associated with lung cancer and not with just any disease, suggesting that smoking has a specific causal role in lung cancer development. The most important criterion is temporality, which dictates that the exposure must occur before the outcome for causality to be established. A person must start smoking before developing lung cancer. If lung cancer happens before smoking, it would contradict the causal relationship. We then turn to the biological gradient, or dose-response relationship. This means that more exposure to the factor should lead to a greater risk of the outcome. The more cigarettes someone smokes, the higher their risk of developing lung cancer, which strengthens the case for causality. Following that, the plausibility of the relationship is crucial. The connection should make sense based on current scientific and biological knowledge. Smoking damages the cells in the lungs, leading to mutations that can cause cancer. This biological explanation makes the relationship between smoking and lung cancer plausible. Next is coherence. The relationship should not contradict existing knowledge about the disease. It should fit logically with what we already understand. The evidence that smoking causes lung cancer aligns with what we know about how smoking harms lung cells and contributes to cancer development. Alongside this, we consider experiment. If we can experiment with removing the exposure and observe a reduction in the outcome, this provides additional support for causality. When individuals stop smoking, their risk of developing lung cancer decreases over time, providing experimental evidence of the causal link. Finally, analogy plays a role. If a similar cause leads to a similar effect in another situation, it strengthens the argument for causality. Just like smoking causes lung cancer, exposure to asbestos is known to cause mesothelioma, showing a similar cause and effect pattern. Conclusion: the Bradford Hill criteria provide a systematic and logical approach for determining whether an exposure causes an outcome. By evaluating factors like strength, consistency, specificity, and others, public health professionals can confidently assess causal relationships. These criteria play a crucial role in shaping public health policies, prevention strategies, and ultimately improving health outcomes.